has been done as far as the mental health implications are concerned? We heard earlier on from Sama that this is one area that needs to be given attention in this fight against COVID-19 in South Africa. Cassandra Govender, psychologist, mental health supervisor, is talking to us now on what it is that has been done and what it is that needs to be done to address this issue. Cassandra, good evening and thank you very much for your time. Healthcare workers in general are more likely to suffer from psychiatric disorders, but more so during a time of a pandemic. What is it in this profession that makes them prone to this disposition?
Well, thanks so much for having me. But I think one of the main things is obviously that during this time, the workload and the pressure and the stress that people are under have increased almost double to what they would normally be experiencing. So I like to think about this pandemic and how during this time period, actually, there were a lot of clinicians and healthcare workers didn't get to experience the stress, the anxiety, the worry, the panic like a lot of the general public, because they had to be the people with the answers, the people that everyone looked to for strength, for calm. So I think, during this time, it's really been a case of them trying to contain and manage and be there for other people and not necessarily be able to process and figure out how they're feeling and they're managing. It's been a constant case of go, go, go.
Is the distress limited to the duration of the outbreak, or even if this pandemic lasted for 3 months, you'd kind of see the same type of impact?
Well, I think most of the impact, as with the general public, is going to be seen when things are not so stressful. So not during the pandemic itself necessarily, but after, because it gives a moment for the body and the mind to catch up with what's been going on around us. I think most clinicians have been in survival mode and maybe are possibly only starting to realize how stressful and how tough the circumstances have been.
Yeah. Of course, it's extraordinary stress, long hours, depleted infrastructure, very little resources. But what are the healthcare workers fearing the most at this time?
Well, I think it's twofold. I think it's having to work in situations and environments where you're not properly prepared, and having to make decisions about life and health of their patients that they weren't ready for. So, for example, who to prioritize for care now that resources are even more limited than they usually are, as well as the fear of catching the virus, not just for themselves, but having to take that home to their families and worrying about the impact that their job's going to have on their family as well.
Now, share with me what you have seen on the ground. I mean, the South African Medical Association saying what they have seen, be it in the private or the public sector, not enough psychological help has been given or counseling has been given to these healthcare workers who've seen quite traumatic experiences.
Well, I think in general, mental health is the thing that we put last, we put on the back burner, which is really unfortunate. We always tend to respond to it reactively rather than proactively. So I think the challenge is that when the pandemic hit, monitoring and putting in place systems to help healthcare workers and the public in general from the onset has probably not been where it should have been. And as a result, I think there are a lot of healthcare workers who haven't or themselves don't even know the importance of managing their well-being during this time. And I think it's because we don't have enough conversations about mental health in general, but particularly during the pandemic.
And what support do you offer doctors at this particular point?
Look, I think the most important thing is there's a whole network, and that's the real thing, is there's a number of different networks that have been set up to try and support healthcare workers. And the important thing is to think about educating healthcare workers in general, not just doctors, about the importance of them looking after their mental health, but on an individual level, but within hospitals and within teams, it's also important that they have education around how to manage well-being within their team. And I think that's something that a few organizations have started to set up.